How's it going, everybody? It's Dr. Taylor, undergraduate exercise science program director and associate teaching professor at the University of Kansas. And welcome to another edition of Fitness Facts. So this is the first video in a two-part series about pre-workout supplements. In this video, I will cover some general recommendations and points to consider before choosing to consume these supplements. So let's dive into this topic. So I just want to go over just some general recommendations and points to consider if you're looking at taking a pre-workout supplement. So make sure and check with your physician before supplementing. And this goes not just for pre-workout supplements, but really for anything that you're going to take, okay? So always a good idea to check with your physician. And the reason for that is that, some of the ingredients may conflict with medications that you're on. For instance, a lot of pre-workout supplements have stimulants in them. And then some of the ingredients can affect things like your heart rate, your blood pressure, and so again, there could be interactions with medications that you're taking that could lead to, potentially side effects, all right? Next, again, these ingredients, because they're gonna have a physiological effect in your body, they may conflict with medical conditions that you have. So especially, if you have a cardiovascular condition, a metabolic condition, maybe like diabetes, or say a thyroid disorder, hyperthyroidism, hypothyroidism, again, check with your physician, okay? That's just being smart. And then also conduct background checks on supplement companies, all right? Look into their manufacturing process, their standards of quality assurance, and we're going to talk more about this in a bit. All right, so some more points to consider here. If you're an athlete and you're considering taking a pre-workout supplement, again, pay close attention to the safety and legality of the supplements you're taking. So some supplements may contain banned substances that are not listed on the label. They may be snuck in there, and obviously, if you're an athlete, especially at the collegiate, professional, or Olympic levels, you could undergo testing at some point randomly, and you may test positive for one of those banned substances, and then obviously you may not be participating in your sport. So keep that in mind. So before I continue on, I should mention that my handwriting's horrible, so I hope that you can read that on the board. I got C's in it in elementary school, and I'm still terrible at writing on the board. So I apologize for that, but we're going to work through this, okay? So some other points here. You want to consume a pre-workout 30 to 60 minutes before exercise. So that's going to give it time to, obviously move from the gastrointestinal tract, the small intestine, into the blood, where it can then circulate to your muscle cells, hopefully. A good pre-workout should increase performance acutely. So acutely, this means immediately, again, within that kind of 30 to 60 minute time frame, okay? You should hopefully see some performance benefits. And what are those performance benefits that you may notice depending on the ingredients that are in your pre-workout? Because some are good, some are bad. We're going to talk about that in another video. You should see increases potentially in aerobic and anaerobic exercise performance. So what is aerobic exercise? Endurance activities, things like running, swimming, cycling. Those are all aerobic activities where you need to utilize oxygen to produce energy in the form of ATP. Anaerobic exercise, that type of exercise is shorter, high-intensity exercise, like maybe doing plyometrics. Weight training is an anaerobic exercise, short sprints, maybe agility drills, things like that. And then another benefit you may see with a good pre-workout is just acute increases in strength, power, and endurance, okay? Delayed fatigue. So the reason that some pre-workout supplements help delay fatigue is sometimes in the ingredients there are ingredients that help to buffer hydrogen ion accumulation, and they help reduce acidity in the muscle cells. So anytime you accumulate hydrogen ions in your muscle cells, that can interfere with contraction, as well as there's other metabolites that can interfere with contraction as well. Also, more alert and focused. Common ingredient is caffeine in pre-workout supplements, and that's the most commonly used drug by Americans every day. I mean, you wake up, you have your caffeine to feel more alert and focused. And we'll talk about the mechanisms of caffeine in another video. There's other ingredients that can help with this too. Reduced RPE. So what is RPE? Rating of perceived exertion. So many pre-workout supplements will make it feel like exercise isn't as intense as what it actually is. So again, you perceive it to be less difficult. Obviously that can be beneficial and make you want to keep going. Increased blood flow, oxygen, and nutrient delivery. So some pre-workout supplements have ingredients that have a vasodilatory effect, meaning that they increase the diameter of blood vessels, and that can improve oxygen and nutrient delivery to working muscles. Some pre-workouts have osmotic effects. So what is osmosis, or what's an osmotic effect? Some ingredients like betaine, we'll talk about this in another video, glycerol, creatine monohydrate. Once they enter a muscle cell, they tend to pull water into the cell. Okay, so they have a hydrating effect in the cell, and that can increase cell swelling. If you increase cell swelling, that may actually act as a stimulus for muscle protein synthesis, because as that muscle cell swells, it creates a mechanical stress on the sarcolemma of the cell membrane, and that could stimulate muscle growth. Facilitate recovery between reps, sets, and drills. So again, some of that ties in with the buffering that I talked about with delaying fatigue. And then also some pre-workouts may have ingredients that help reduce DOMS. So DOMS is delayed onset muscle soreness. And so DOMS is what you feel, 24 to 48 hours after an intense workout due to some little micro trauma and tears in your muscle fibers. So sometimes these supplements can help reduce that. All right, so make sure you avoid taking your pre-workout supplement 4 to 6 hours before bedtime, because again, with the ingredients in many of these, they may keep you awake because they have stimulant effects often. So don't overconsume your pre-workout. Okay, this is a common thing. People do it a lot. Just stick to the recommended dosages, all right? So what are the side effects that you may see with a pre-workout, depending on if you're sensitive to some of the ingredients? And again, this is why it goes back to checking with your physician. Headaches, nausea, anxiety, restlessness, right? Again, these, because many of them have stimulants. GI upset, for instance, caffeine, sometimes it irritates people's stomach and their intestinal tract. Insomnia, which is why you don't consume it 4 to 6 hours before bedtime. Jitteriness, again, that stimulant effect on the central nervous system, so that's why you want to stick within those recommended dosages. Tachycardia, what's that? That's an accelerated heart rate. So typically a normal heart rate at rest is between 60 and 80 beats per minute. If the heart rate's above 100 beats per minute at rest, we call that tachycardia. In some individuals, maybe irregular heart rhythms. So dysrhythmias, if you want to use the technical medical term. Sometimes you may see increases in blood pressure, transitory, okay, so temporary. Dizziness, and then also some ingredients have a diuretic effect, so they could actually dehydrate you. So some things to look at and avoid if you're going to purchase pre-workout supplements. Don't purchase a pre-workout supplement that has a proprietary blend listed on the supplement facts label. Okay, so what's a proprietary blend? Well, that's basically where they just list a whole bunch of ingredients, and the proprietary blend may be 5,000 milligrams, and then all the individual ingredients are itemized and listed under that 5,000 milligram dose, but you don't know the exact quantity of each ingredient. Okay, and so that's a problem, because as a consumer, I'm skipping down to this bullet point, you deserve to know what you're paying for. All right, and so the exact quantity in milligrams or grams of each individual ingredient should be listed, but that doesn't happen in a proprietary blend, so you don't really know the exact amount of each ingredient that's listed on the label, right? And oftentimes supplement companies do this because they're underdosed, right? So you're actually not getting an adequate, effective dose of each ingredient to actually give you the response physiologically that each ingredient is supposed to do, okay? So it's underdosed, and you're paying for a supplement that's underdosed. So avoid proprietary blends. Then down here, use pre-workout supplements with ingredients based on scientific research. So some supplements have ingredients that are not based on scientific research and are not going to be as effective as other ones that are. All right. So a good pre-workout, again, is going to allow you to train harder, for longer, and with hopefully less fatigue. All right, so a 2019 review paper by Jagam and colleagues analyzed the top 100 commercially available pre-workout supplements. And what they were wanting to do with this study is analyze the prevalence of ingredients in these commonly available pre-workout supplements. So what were the results of the study? What ingredients were most commonly found in pre-workout supplements? Beta-alanine was number one, so 87% of the top 100 commercially available pre-workout supplements contained beta-alanine. And in a separate video, I'm going to go over kind of the proposed mechanism of action, effective dosages of these different ingredients and what they do, so you can have an idea of how they're supposed to work in the body. But again, just to go through these, beta-alanine was number one at 87% prevalence. Caffeine was the second most prevalent ingredient in pre-workout supplements. You go on to citrulline, tyrosine, taurine, creatine, niacin, arginine, and vitamin B12. So in part two, the next video I release, I will discuss in detail several of these common pre-workout ingredients. I'll explain the proposed mechanism or mechanisms of action and suggest dosages you should consume of each ingredient to provide performance enhancement benefits in a safe manner. In addition, I will highlight which ingredients have the most scientific evidence supporting their ability to improve performance acutely. I hope you enjoyed this Fitness Facts video. Thanks for watching.